Hi, my name is Dr. Sundeep Mangla, and I'm a neurointerventional radiologist and expert in cerebrovascular diseases. I have a brain aneurysm. Now what? Many factors help guide the management of brain aneurysms. Ruptured or symptomatic brain aneurysms require urgent treatment in most cases. Treatment can be minimally invasive or endovascular or open surgical. Here we have an example of a minimally invasive endovascular approach, where we navigate a small microcatheter into the aneurysm sac and place coils, essentially blocking off the aneurysm from the parent vessel circulation. In some cases, we can use what we call a stent or a flow diverter to help bypass the aneurysm and prevent aneurysms from growing or bursting. Here is an example of a patient with multiple brain aneurysms. In this area, we can see that there is a bubble that's formed in one of the branching points. This, we feel, is the ruptured brain aneurysm. In addition, this patient has a second aneurysm, which appears to have a more smooth surface, which we believe is the unruptured brain aneurysm. In this case, however, we decided to treat both aneurysms. We placed coils inside what we believe is the ruptured aneurysm, and as we withdrew the catheter, we placed additional coils in the second aneurysm. And in this picture, you can see that both aneurysms have been successfully treated. Here is an example of a child with a brain aneurysm that had ruptured. In some cases, the aneurysm is very high risk for endovascular or minimally invasive treatment. In those situations, we consider surgical treatment for the brain aneurysm, which involves an incision in the scalp and skull where the brain is explored and a microsurgical clip is placed across the neck of the aneurysm to block it off from the brain circulation. You can see on the postoperative imaging that there has been complete occlusion of the aneurysm and protection from catastrophic rupture events. What if my aneurysm hasn't ruptured? Well, there are many factors to consider when managing brain aneurysms, including age, comorbidities, the location of the aneurysm, as well as the size of the aneurysm. In certain cases, we can closely monitor the patient and reduce their risk factors, including controlling their blood pressure and smoking cessation programs. In high-risk cases where we see aneurysms have grown or they are in dangerous locations, we consider treatment. Whenever possible, we consider neuroendovascular or minimally invasive treatments, but when necessary, open surgical treatment is often considered as well. Every brain aneurysm patient should consult with an experienced neurovascular specialist and customize their management options for their own personalized situation. Look forward to future TikToks on brain aneurysms.